Hi everyone, welcome to part 3 of our trigger point series. Today we're going to do some trigger points in the low back, in the hips, and down the legs. So the first one we're going to talk about is the low back muscles. So we have our lumbar paraspinals as well as our quadratus lumborum. So this is basically the whole side of your back here, and it comes out quite far on the side, okay? So we'll use our trusty ball against the wall. You don't want to go right onto the spine, so if you find your spine, just move to the side, and you can either press in, you can roll up and down, or side to side, whatever feels good. And I want to make sure that you turn as well, so make sure you get that side part. Usually some good spots in there. So spend about 30 to 60 seconds working these. Make sure you do both sides. These muscles can give you pain in the low back, in the buttocks region, the abdominals and the hips, and even down the back of the legs. The second muscle we'll work on today is actually a group of muscles, so we'll do the glute muscles. 3 of those, and the piriformis, which comes across there as well, okay? So that whole buttock area is a lot of muscle. These can give you pain in the sacrum area, the tailbone, the low back, the hips, and down the back of the leg. It can even feel like sciatic pain. So these are really great to work. So they do come right across to this hip bone you feel on the side there. So if you take your ball, you can start at that bone and work your way back, or you can start at the sacrum, work your way up to that bone. So ball against the wall. Again, you can press in, you can roll side to side, and the glutes come quite high up into that crest of the hip you can feel, so make sure to get that area too. Third muscle we'll talk about today is a very small muscle. It's called the TFL, or tensor fasciae lata. So if you find your hip bone in the front here, you have your hip bone you can feel on the side there. Basically right between there is that little muscle. This can cause hip pain, pain down the side of the leg, or right on the side of the knee there too. Very common in runners. So take our trusty ball, again, find those 2 bones, put the ball between, and lean in. Again, you can just press in, you can roll up and down. Get pretty close to those bones too. The other muscle we're going to talk about today is the calf muscles. There are 2 of those as well. Basically this whole area under your knee, you feel that bulk there. It is on both sides, so you want to make sure to cover a good area there. This can give you pain along the calf area itself, the back of the ankle, or even the heel and arch of the foot. So again, you can take your ball, place against the wall, and again, push in, roll back and forth, and make sure to turn your foot both ways so that you get both of those sides of the muscle. Now you can do this sitting down as well. As long as you have a firm surface, you can put the ball underneath your calf on the floor as well. Or if you're stuck at work sitting in your chair, you could cross your leg over and use your opposite knee to massage in there. The last thing we'll talk about is the plantar fascia, and these tiny foot muscles at the bottom of your foot that can give you arch pain and heel pain. So again, using our ball, if this ball is too big, you could use a golf ball. That's usually a nice size. Or if you have plantar fasciitis, you could use a water bottle that you freeze, and you can roll your foot over that. So that concludes our trigger point series. One thing you might be thinking is, what do I do after I release these? So you can do some light activity or light stretching. You can check out our website. We have some gentle exercises on there as well. You want to stay hydrated, or if you're sore, you can get a nice hot bath with some Epsom salts. Now you can work a trigger point multiple times a day. I would probably start with twice a day, work up from there. Okay, see how you feel. Excellent. Have a great day.